Okay. So my name is Linda Bryant Daaka, and I work for the Black Parent Initiative. So I'm a manager of a program called the Sacred Roots Doula and Mobile Lactation Services Program. And so that program has been in existence actively since 2017. Funding was started by an insurance company, Family Care, in 2016. They actively started the program running 2017. So I worked there as a full-time IBCLC, but we're talking about how did I actually get started to actually work and develop that program. So I got my start actually, Michelle said in WIC, but actually my first lactation job was with a hospital.
Oh.
There was the first lactation research project that was with in Connecticut, Hartford Hospital, that's in Hartford, Connecticut, and the University of Connecticut, and then a Hispanic Health Council program. So I was a stay-at-home mom and I wanted to get back out into the workforce. And I actually saw an ad in the newspaper for a peer counseling program. And as I'm reading the article, it said, oh, okay, we will train you to, if you have been a breastfeeding mother for at least 6 months. And I had 10 children. So I said, whoa, okay, this works fine. You know, I was so elated. So I actually applied to the program, and it was a very interesting program because it was community and hospital based. I had 2 different IBCLCs, one at the hospital level who was a nurse, and the other was a community IBCLC. And so she had a background in, I believe it was public health. So we worked on the community level, and we actually went into the hospital, looked at the board every day who was inpatient, and we actually worked with those mothers. And when they went home and they had challenges, we actually went to their homes. So that was my first actual lactation job. And I will say that a lot of the things that they allowed us and taught us how to do would be considered out of scope for a peer counselor. So I actually had that first start there. So then when I moved from Connecticut, I moved back to New Jersey, where I'm originally from, and I was looking for a program similar to that. And I actually couldn't find anything. So I went into home visiting and parent education. So I figured if I was going to leave my children, I always wanted it not to be with a business, but more in line with, you know, a social service type program, helping other mothers. So keeping with that, I worked doing that for a while. And then I worked with one organization, and they had quite a few lactation consultants. And so I asked them, the program that I was working with as like a parent educator, I was asking the IBCLCs that were there, these nurses, so who is helping these moms that I'm working with? And it was a maternal and child health program. And they actually said, well, I guess nobody. And because they were doing other things. So I actually asked if the grant, it was a Healthy Mothers, Healthy Children's grant from federal level, but we were doing that grant. So I said, what about if we established within the program with the mothers who have delivered babies, if I can help them? And then they said, well, that's fine, you know, document the hours and what you're doing. And then we also established that WIC needed help. They didn't have anybody of color working there. So I became a peer counselor, split up the grant. I did 8 hours a week with WIC. So then that was my first encounter with WIC at that point. So then after I started working with that program, then it was a program for homeless women. Most of them were teenagers, and it was a house that they stayed in, a residential program. So I provided that work there. And that was also in New Jersey. And then when I moved to Maryland, then I finally formally worked for WIC. And then I got the kind of help in terms of getting lactation specific education, because it is very expensive. So when I went to Maryland, the person that was my supervisor there, that was a director of the program, you had a couple zip codes that you work within and you covered that area. So when I talked to, about all the needs that I saw in Black communities, duration rates. So when I started at that WIC office, I think maybe 85% of the women there were African-American or African, and we had a 24% rate of initiation. So it was pretty terrible. So she allowed me to be creative and help expand the program until when I finally left the program 6.5 years later, we were at 74%. So that was, you know, just exciting to see as the program grew. And within that time, she invested in my lactation education, my first lactation specific education beyond that first hospital experience. So that was with Healthy Children's, and they paid for it. And then I took a course with Marie Bancuso. That was my second course, and it's very helpful. And so they're two different, to me, they were two different aspects of the same thing. But she goes into, to me, more of a research aspect and things like that, a little bit different than Healthy Children's. But Healthy Children's, though, I will say personally encouraged me to sit for the test. They said, you can pass the test. You just need to sit for the test. And so they told me that, so the first year I took it, I was late for the test. Yeah. And so, so I had to take it. So that was 2010, and then I took it again in, so I actually took it in 2011 and passed the test. And that's where I actually, so I did get the help that I needed to circumvent that financial aspect from WIC. And then I could meet the hours easily because I was working 40 hours a week and doing nothing but lactation. So I had the hours, etc. And so that's where I actually got the start. And then when I came here, I started as a doula here in, so that was 5 years ago. And then I noticed that there were so many needs that the clients had with lactation wise. So then I broached the subject, why can't we expand the lactation side? So I started there as a doula, then I became the coordinator of the program, then I became the manager of the program. And so we've since expanded the lactation part of the program, and we do a lot of mobile services. So we go into moms' homes. We are a culturally specific program. So we work with moms who look like us, you know. So in terms of that, so we're working with moms that self-identify as Black or African or biracial. And so that's what who we serve. And there's a pressing need. And we know about the maternal child's health statistics that we have in the Black community. And we know that breastfeeding is going to be a very, very important part of looking at health disparities, and hopefully in the future to diminish those things with moms breastfeeding for their health and for the babies and benefiting the community. So that's my story.
Okay, wow. Thank you for that. Linda, can you tell us about a challenge that you ran up against along the way?
That program that I told you that had the IBCLCs that were nurses that were there, my immediate supervisor was an IBCLC. And when I asked her, how can I get into becoming an IBCLC? Well, they told me that I didn't have my college degree, so it was impossible for me to become an IBCLC. And at that time, it did not require you to have a college degree. But every time I broached the subject, I had an immediate supervisor, and then I had a supervisor over her. One was a nurse, and the one immediately over me was a dietitian, and she was Hispanic, she was Cuban. And they both told me the same thing. And it was like freaking frack, you know, they supported each other in keeping me from being able to discover what the true pathway could be and what I could accomplish. So I actually had to find out for myself, and actually knew then what could be accomplished, but not having the funds to actually accomplish it. So, so that was a hurdle right there to get around.
Sure.
First, to feel like you being minimized, but my skills were being utilized, but not being able to be looked at as, okay, it is possible, and how can we support her? So it took another 5 years before I got into a situation where I was supported and people were willing to help me to reach that goal.
Well,
And so I
thank
always,
goodness for that.
yes, and I always feel responsible to pass it along, to be able to help and look out for my community and make sure that other people can have that options. And as much as they want to learn, we want to be able to help them learn and support them.
Perfect. And my last question for you is, if you could go back in time and talk to your 2010 self, what would you say?
You should have asked about the traffic pattern. And because I took the test in Maryland, DC at Georgetown University, and I did not know the campus, I would have been better off just taking the train, but I drove in and it was horrible. And you panic and anxiety. And then there was no signage until you got right in front of the correct hall. So I couldn't even find it. I was 5 minutes late, but they wouldn't let me in.
Oh my gosh. Oh my gosh. Well, that's a good message. I
Yes.
think for all of us.